Can I ask you a question on prostate?
Yeah.
So,
So apart from brain, I can
you can
everything.
okay. We often get patients who routinely screen for PSA. Do you think PSA screening is now scientifically advisable? We are not sure.
All right, so I can tell you what I'm definitely sure of. Above the age of 70, no PSA to be done ever. End of story. It's completely useless, of no point. It may come high because above the age of 70, about 30% of people will have some prostate cancer foci, which can raise the PSA a little bit, but those prostate cancer foci are unlikely to be the cause of you getting symptomatic or dying of prostate cancer. As you grow older, even more so. So at the age of 80, 85, if you're going to do a PSA to diagnose possibility of prostate cancer, at 80, 85, 50% of people will have on biopsy some prostate cancer foci and nothing further needs to be done. So your only challenge is people between the ages of 50 and 69. Should we do a serum PSA to diagnose possible prostate cancer? The earlier guidelines from the American and the European societies were very, very strong. Yes, you must, because you pick up prostate cancer and you can treat it and you save lives. But people have now found that it doesn't seem to change the trajectory of most prostate cancers if they are screen detected. So what it means is that if you are symptomatic and a prostate cancer is found, that's a different thing. You treat it, it's a disease, etc. But when you pick up a prostate cancer in an asymptomatic individual with screening, doing PSA, there are two things. A, the treatment doesn't change the eventual prognosis. And B, the surgical options, none of them are particularly good. That, you know, a patient often will turn around and tell you, nahi kiya hota serum PSA to bahut acha tha. Now we found something on prostate, now we have to do a biopsy, and on MR prostate, then we have to do a biopsy, then you do a PET CT, PSMA PET is a specific PET CT we do. And now they're telling me to choose between cryo, brachytherapy, surgery, robotic, etc. I don't know what to choose and I don't know what I should do and you know, all of that. But let's come back to the first one. And this is a very interesting study because very few randomized controlled trials exist for treatment in prostate cancer. And the NHS was able to do this 15 years ago. I don't think they would be able to do it today. They took screen detected prostate cancers, which means completely asymptomatic individuals, about 1,500 of them, where the prostate cancer was only picked up because they went for a screening test and the PSA was positive. All right, that's the baseline. 500 were told do nothing except we will follow you up. 500 were given surgery, 500 were given radiotherapy. Followed up for 15 years. End of 15 years, eventual outcome, same. Which means if you took those 500 people where nothing meaning active surveillance, you follow up, if they grow, you treat, if they don't grow, you continue to do active surveillance, and they found that that strategy worked equally well.
If the PSA is high and the patient now says my PSA is 40, the next step sometimes is to go to a urologist who will do a prostate biopsy.
No, they don't do it. No, the first
So
thing
MRI
is a prostate MR.
So MR has to be the first thing. Even if they feel a hard prostate on PR, then MR still remains.
So now it's become standard MR prostate, and then based on the findings you do a transrectal, because what also happens is that while they do a 12 quadrant, if the MR has identified an area that is abnormal, then you will focus on that more so that you don't miss any cancer at all. And then you do a truss guided biopsy. And then if it's 40, you will also do a PSMA PET to see if there is any spread anywhere else. So up to anything above 15, you would do a PSMA PET for sure. Less than 15, it's a clinical judgment call.
PSMA PET, just to orient you, is a PET scan where FDG is not used. What is used?
Prostate specific membrane, the same PSA, the PSMA is the receptor in the cancer, and this particular radioactive dye will bind to that and show it up. So all prostate cancer PET CTs are called PSMA PET CTs, and you have to ask for it.
Forward. What is